Hello everyone, this is Cecilia Hall. I am a nurse manager at the University of Mississippi Medical Center as well as adjunct nursing faculty at Hines Community College School of Nursing here in Jackson. Today's discussion will be about interprofessional education. Can it curb the nursing shortage? Some of the goals and objectives of this presentation will assist the viewer in being able to gain a basic definition of interprofessional education, IPE. It will also help the viewer identify which authorities support IPE, as well as consider the benefits of IPE. We also will be able to understand how IPE could impact the future nursing shortage. We will first begin by having a basic definition of what IPE is. It is shared learning experiences among health profession students with the goal of building strong clinical teams and improved health outcomes. The United States is in the midst of an extensive change in healthcare. And this is affecting all of the health professions, but especially medicine, pharmacy, and nursing. Not only in the workforce issues, but it's also affecting how we educate in the health institutions. This presentation will discuss IPE and how it can impact nursing in particular and help us in the healthcare reform in an advantageous way. It can somehow assist in curbing the nursing shortage as well. We will continue to discuss throughout the presentation what IPE is, along with the authorities and the benefit of IPE. Once there was a statement made by Winston Churchill, and it said that the further that one can look backwards into the past, the further that person can look ahead to the future. We want to look at our past mistakes and learn from them so that we would be successful in the future. It is the opinion of our authorities and accrediting bodies that IPE is going to work to our advantage in our health reform processes. So who supports IPE? We have several listed authorities here, but there are others. The American Association of Colleges of Nursing, the World Health Organization, the Institutes of Medicine, the Robert Wood Johnson Foundation, as well as the Josiah Macy Jr. Foundation. As I mentioned earlier, there are others. So why utilize IPE? Well, we would want to utilize IPE education because it trains health professionals to work in a collaborative manner, and it also assists in coordinating the care across healthcare disciplines. More minds involved will yield better patient outcomes. Not only will this assist with other healthcare disciplines, but for us nurses, it will serve to facilitate in the sense of empowerment over our practice. Additionally, another reason why we would want to utilize IPE is that our accrediting bodies of the schools of nursing, the schools of medicine, pharmacy, and others are even pushing for the establishing and the embracing of IPE. We have already begun deliberations in the three main schools of nursing, medicine, and pharmacy to begin to embrace this concept. We have found out one of the greatest advantages of IPE is that it provides coordinated care and collaboration. It provides a sense of partnering, and it brings together all the pieces of the puzzle. We find that nursing in particular designs, implements, and participates in care management as well as care coordination. It is the nursing profession that facilitates effectiveness at the collaboration table because coordination of resources years patient-centered care better than any other skill set. And nursing is that discipline that seems to bring this particular coordination of care and collaboration to a realization, and it yields that better patient outcome that we're looking for in our healthcare reform process. Historically, we know that when we have educated rather in silos or segmented off from one another until we enter the practice field, we have noticed that our disciplines have role confusion, educational isolation. We even see professional rivalries. And at times, most of the time, there is minimal interprofessional collaboration. We know from looking over historically and looking in the past that we do need to change how we have executed and educated and how we may even practice for a greater good. We're living in a time where we need to use our resources better and how to do more with less. Working in partnerships and power sharing and consulting and having joint ways of working together are essential for health service delivery. The healthcare professionals will need to understand the importance of promoting autonomy with individuals and the concept of power sharing. Healthcare calls for greater adoption of clinical pathways and for interprofessional models of care to replace the traditional models. It is teamwork that enhances healthcare disciplines' knowledge and understanding of the collective expertise and resources and how they may be utilized appropriately and efficiently. So again, let me bring emphasis that the benefit of IPE is to improve patient outcomes, to establish the mutual respect of one another's practice, to have better utilization of work resources, conserving costs, and again, to decrease the impact of the nursing shortage. According to Dr. Elizabeth Speakman, co-director at the Center of Robert Wood Johnson Foundation and the Executive Nurse Fellow, nurses will have increased empowerment, which will then lead to increased morale and job satisfaction. Once this happens, we will see improved nursing retention and recruitment. So we will push for interprofessional education. We will support the accrediting bodies, and we will work with our educational institutions from nursing leadership and nursing educator standpoint. This will positively impact the nursing shortage that is predicted. As nurse leaders and educators, we want to be a proactive group versus a reactive one. We want to plan today how to do more with less. We plant seeds today for tomorrow's crop. It is in our best interest that we look forward to the establishing and the growing forth of the IPE respectfully, and that we embrace this new concept into our worlds of practice and for our patient populations and for our societies as a whole. Our takeaway, I hope for you as we have discussed IPE and the advantages of it, is that as healthcare education takes place in this interdisciplinary model, individuals that will be entering the workforce will enter into practice with the predisposition that collaboration among all healthcare practitioners is the norm for efficient and quality healthcare. This will result in enhanced communication across the disciplines and patient care that is safe and cost-effective and of excellent quality. Thank you for joining me in my discussion on IPE, interprofessional education, and thank you for promoting this concept in your areas of work.